Hello, I am Walter Gottlieb. I'm the communications director here at NCPSSM, the National Committee to Preserve Social Security and Medicare. I'm very happy to be joined today by Dan Adcock, our Director of Government Relations and Policy. How are you doing, Dan?
Great, Walter.
Thanks. Thanks for doing this. We are here to kind of knock down these ridiculous TV ads that say that Joe Biden is trying to cut Medicare Advantage. That's the private version of traditional Medicare, that he's trying to cut Medicare Advantage and that's going to cost beneficiaries $500 to $1,000 in benefit increases. Why is that, for a lack of a better word, BS?
Well, first off, it's not a cut. Actually, because of changes in the way that Medicare Advantage plans are audited and also the way they're paid will still result in a 1% increase for Medicare Advantage plans. But what this is all about is that the Biden administration is reporting to abusive and wasteful practices by private Medicare Advantage plans that give them an overpayment, more money than they're entitled to, by cooking the books, especially on some of their sicker patients, rather patients that they claim or have greater health problems and sickness. And by doing that, they can get more money for each of those patients, even though that particular patient may actually be healthier. This is a practice called.
So in other words, the Medicare Advantage companies have been ripping off the taxpayers, and they're under investigation for overcharging the government, right?
That's correct.
Okay, and so this new payment model says we're going to take that fudging that Medicare Advantage is doing into account when we figure out how much we're going to pay Medicare Advantage per patient. Is that correct?
Yeah, that's right. They're trying to by doing a better job of auditing these plans. It's a way to provide the plans a more accurate payment, a payment that they should be entitled to if they were to be more straightforward about their accounting.
And so here we have Medicare Advantage. Let's say that the Biden reimbursements or payments to Medicare Advantage next year are 1 or 2% percentage points lower than they were, even though the Biden administration says no, they're going to get a 1%. But let's say, as the industry claims, they're getting 1 to 2% less. Why does that not equal benefit cuts for their subscribers?
Well, because these private Medicare Advantage companies are making money hand over fist. And so what it might mean is they might make a little bit of money, but they're still going to make, a boatload of money, even if it was an actual cut. And I think the other thing to keep in perspective, it also, even if it were a cut, it would make up for years of overpayments to private Medicare managed plans. The Medicare Advantage plans were never supposed to get more money than traditional Medicare, but unfortunately, that's been the outcome under current law.
Right, and just to sort of reinforce your earlier point, the whole idea of Medicare Advantage is that it could do better patient care for less money, and instead it's costing taxpayers more money to have people in Medicare Advantage than in original Medicare. Is that right?
Right. Well, and I would even go further. What's happening is that people who stay in traditional Medicare through their payment of their Part B premium are helping to subsidize people who are in Medicare Advantage, sometimes get a few little extra benefits like dental and vision, which, by the way, in Medicare Advantage plans are fairly limited.
It reminds me of what our president, Max Richmond, has been saying, that, hey, Medicare Advantage insurers, if you're worried about getting a little less from the federal government, pay Joe Namath and William Shatner a little less for those bogus TV ads.
Right.
And that's another thing, correct me if I'm wrong, that the administration is doing. They're trying to crack down on those misleading ads that make it seem, Joe Namath, Jimmy Walker, William Shatner, that make it seem like Medicare Advantage is Medicare, the whole program, and you have no choice. And you call this 1-800 number, all of a sudden you are sold a private Medicare policy. So what is the Biden administration doing to try to make those ads more transparent?
Well, there's also another set of regulations that have been proposed to do exactly that, and also to enforce upon these plans that they have to be clear about what a Medicare Advantage plan is. If it's a private plan, it's separate from traditional Medicare.
I mean, is it fair to say, I guess here at the National Committee, we say, look, Medicare Advantage is okay if you're a healthier or younger senior, but you get older, you get chronic or acute conditions, you could be in a lot of trouble.
Right. Yeah, and there are many plans that are good. There are very many medicated Medicare Advantage plans that are good plans that their enrollees are happy with it. But this is sort of what isn't said in the advertising is that the older or sicker you get, the ability of those plans to provide you quality health care will go down especially because they have fairly limited provider networks. You're going to have a much larger network of providers available to you in traditional Medicare than under private Medicare Advantage plans.
And meanwhile, here they go. They're under investigation for denying pre-authorizations for procedures that should be approved. They're denying claims for care that would automatically be covered under regular Medicare. It's pretty corrupt in some cases.
Yeah, well, I mean, and the way they are set up is they get a payment, and if they can keep more of that payment than actually spending it on healthcare, then they're essentially what they're going to do is ration the healthcare of their enrollees as much as possible.
You're saying that in the private insurance model, they're incentivized to maximize profits and to minimize patient care to the extent they can get away with it?
That's right. Well, and that's the irony of it is that, there's a lot of people who have been in private health insurance throughout their working lives. They retire, they turn 65, they become eligible for Medicare. And I think for the people who are very attuned to that, they realize that traditional Medicare is a great deal for them versus what they had when they were working for an employer that provided their health insurance. But many fall into the Medicare Advantage trap, not knowing that eventually they're going to have to switch out to traditional Medicare if there's a doctor they want to see that isn't covered by a private Medicare Advantage plan, but would be available under traditional Medicare.
Yeah, those are very good points. And I just want to end by, coming back to the beginning, which is that Kaiser Family Foundation did an article recently that says, and I quote, "Some in the industry say the payment changes by the Biden administration will lead to premium increases or cuts in benefits, though there is no evidence to suggest that."
That's right.
So these ads, it's an unfair fight because traditional Medicare doesn't have the money to advertise, can't hire celebrities, right? It's just an unfair fight. But, we're here to tell the truth, to inform the public. And I thank you so much for helping do that every day, Dan.
Happy to do that. Thanks, Walter.
Okay.